This webinar was recorded for subrecipients of the Tennessee Strong Families Grant on January 27th, 2025. Carvonsha Shaw Baker, MHA, CLSE, and CEO and founder of Labor of Love LLC was our subject matter expert presenter. This training was designed to promote a holistic approach to pregnancy health and postpartum recovery, strengthen maternal health awareness, and provide ideas for community education, and give subrecipients tools to help clients cultivate a supportive perinatal health journey. The slides and reference materials are posted on our webpage for your reference and review.
So today we're going to be learning about maternal health from Shay Shaw Baker. She's the CEO of Labor of Love LLC in the Nashville area in Tennessee. Shay is so passionate about helping expectant mothers have the most positive birth experience possible. And she has unique field experience that brings a lot of value for our organizations who are working with pregnant moms. She's planned a really comprehensive session today that's going to take us through all the ways that we can support moms in each trimester. So we got a couple of interactive polls and ways that you guys can ask questions. So please feel free to interact and ask questions as they come up. And I'll go ahead and hand it over to Shay. Thanks for being here.
So, hey everybody, I want to welcome you guys definitely to this webinar. I'm really excited to be here. So, of course, today we're going to be talking about supporting mothers through pregnancy, all the way through postpartum and beyond. So, thank you again, Brooke and Chase, for inviting me to do this webinar. I'm super excited. My name is Shay. I also go by Doula Shay. I am a birth and I'm postpartum doula here in Nashville and other surrounding cities. Just like Brooke said, I love everything regarding pregnancy, labor, delivery, postpartum, breastfeeding, and beyond. It's my passion. I have had my company now for many years. I've been able to serve many, many women through pregnancy, birth, and as well as postpartum in their breastfeeding journey. So it just comes natural when I get to talk about the well-being of an expectant mother as far as taking care of them through pregnancy and beyond. Um, so one of the purpose of the webinar today will be able to provide practical and actionable insight to how we can, as in community and organization, how we can better support mothers during one of the most transformative times in their lives. So I do want to again thank you guys for taking the time to join us here during this webinar and be sure to interact. We have a couple, Brooke already told you, we have a couple polls that are going to be up through Zoom and also that you can kind of participate in. So I look forward to being able to answer some questions at the end of the webinar. And I'm not going to be looking at the chat as I'm talking through the webinar, but I will definitely check it at the end to be sure that I'm able to answer any questions, and any questions that I'm not able to answer at the end of the webinar. Brooke will be more than happy to follow up with the answers to that. So when we talk about maternal health, one of the key things that we must understand is that maternal health doesn't just impact the mother, and it's the foundation of basically a growing family. So maternal health is not just mom, it's also mom, baby, and overall well-being. So from the point of conception into pregnancy and through 2 years postpartum, I like to say beyond your postpartum, as long as you've had a baby, many new mothers will face physical, emotional, and mental changes that all require a specific type of care. So, when supporting mothers through each of these phases, we can help reduce some of these risks and improve a lot of outcomes for their overall maternal journey. This webinar will be designed for organizations such as yourselves. I've seen some of the organization listed in the chat, such as like pregnancy centers. I saw some mental health facilities and other type of community organizations that are all working together to create better systems of care for women throughout their pregnancy and beyond. So whether or not you are a healthcare provider or an advocate, this session would definitely be beneficial to you. As far as our agenda, I've structured it in a way to better help and understand the support of an expectant mother and what she needs by trimester. So we're going to take kind of like a journey through the trimesters, and we'll break down and individualize what each mother needs and what is critical during each trimester in order for her to have a overall positive pregnancy, positive delivery, postpartum, and beyond. We'll start, of course, with the first trimester, then we'll move on to second, third, and we'll end with the most critical and often the most forgotten trimester, which is the fourth trimester, also known as postpartum. We'll end the webinar with, like I said, plans and actionable steps that you as organizations can start and help women along their pregnancy journey as well as postpartum. And then of course, we'll end with a webinar just in case a Q&A, just in case anybody has any questions that I wasn't able to answer through the webinar. So if you do have a question and you're like me, you're forgetful, yeah, you can go ahead and drop it in the chat. And like I said, we'll go back and take a look at all of those. I like to have fun. Short answer. I like to have fun. And so I thought it would be a great opportunity to open up this webinar with just kind of a fun game. And so this game is going to be called Myth and Facts. So you'll see on your Zoom polls, there are a few questions. There are only 4 questions that are going to be on the screen. And these are all questions regarding pregnancy, childbirth, and also postpartum. Since pregnancy and childbirth can be both exciting and scary, and a woman's body will go through so many physical and emotional changes throughout her entire pregnancy, there are a lot of myths that are circulating on the internet, and these types of myths are sometimes confusing what's best for the pregnant woman as well as for her baby. And so I think it's really important that we as facilitators be able to decipher through what's an actual evidence-based science versus what's a myth. And this way, we're able to provide women with more of reassurance and calmness through their pregnancy that will kind of help them better navigate. As a doula, I always tell people if you think you have to ask Google, you're already asking the wrong thing because Google will tell you that you're dying when you're actually 8 weeks pregnant. So I like to be really mindful and encourage women if they're going to seek out information because you just will, especially if you're a new mom and you've not established care with a provider. It's just something in us. We have so much ease of access to resources online. It's just really easy to go onto the internet to find what we think we're looking for. So I often like to encourage women, if you are going to search the internet, we want to be able to point them in a direction to find information that's evidence-based science and is actually relatable to them. So I hope you guys will play this game with me and join me in putting your answer on whether or not you think these are myths or whether or not they are facts. You can also do them in a chat or you can put them in the Zoom poll.
I'm going to go ahead and end the Zoom poll. We've given it about 2 minutes, and I'm really curious, Shay, what the answers are for these because we have some disagreements in the chat or in the poll. So I'll go ahead and
I
end
love
it
it.
so that you all can see it.
I love it. Thank you
Can y'all
guys
see the
so much.
results?
Oh, awesome. Love
Okay.
it. Love it. Thank you guys for participating. So yeah, we're going to go through, these are 4 common myths or facts that pregnant women, kind of the top 4s that we see research often. So number 1, whether or not you're eating for 2, is this a myth or is this a fact? This is actually, I see the polls are kind of like half and half. This is actually a myth. Eating for 2 is a really popular phrase that shouldn't really be taken literal, only because a pregnant woman doesn't need to eat twice as much. In fact, if she's doubling the amount of calorie intake, that could lead to unnecessary excess weight gain, which could potentially cause later issues in her pregnancy. So no, it is definitely not a fact. You are not eating for 1. You just need to eat to sustain you as the pregnant or her as the pregnant woman. So the second myth or fact we have is it dangerous if you go past your due date? This right here really puts people in an uproar just because they don't simply know. But this is actually a myth. It is not a fact. Since the due date is estimated and is calculated based off of a 40-week schedule, it is totally normal to give birth before or after a set due date. Babies are not on a schedule. They don't have a time frame. They choose to come when they want to come, but oftentimes it is definitely not harmful if a woman goes past her due date, just because, like we said, it's a rough estimate. It's nothing about an estimated due date. People forget the estimated part of due date. Nothing about that is a guarantee. So In fact, if a woman goes 2 weeks past her due date to be considered a post-term pregnancy, it would have to be 2 weeks prior to the date that she was first given. So it's totally safe under a medical watch if she does go past her due date. Thank y'all for participating. I like the engagement. So number three, myth or fact. Once you have a C-section, you will always have a C-section for your future pregnancies. This also is a common myth. Many women believe that if they have delivered a baby via C-section or cesarean, that they will have to schedule another C-section for their future pregnancy. There's been a lot of new evidence-based research that's come out that says that this is not always the case. Women have the opportunity to consider a VBAC, which is a vaginal birth after a cesarean. This is definitely an option for many women. It does depend on a few factors such as health history, the reason why they had their initial C-section, um, the C-section scar location, and all of these things can be discussed with their OBGYN or their midwives. And their midwives will basically screen them to see if they're a candidate for a VBAC. But nope, it's not true that once you have one, you always have to have a C-section. And then our very last myth or fact. Does age, education, culture, or socioeconomic status determine, excuse me, if the woman will have perinatal depression? And this simply is also a myth. It can happen to any woman. So that's just kind of how I just kind of summed that up. Depression doesn't have a preference. It could happen to any woman. And so that's just something that we as facilitators want to be knowledgeable about, because these are some of the common things that most women are worried about as soon as they honestly find out about pregnancy, depending on if it's their first time mom or repeat mother. So, like I said, these are just a few of the many myths that are floating around the internet, floating on TikTok and Instagram that women are using to find. So, we as facilitators want to make sure that we provide women with facts, science, evidence-based research, updated information, and there are reliable websites that you can check out, like the ACOG is really amazing. That will provide these women with the actual facts that will help bring them reassurance, calmness, and overall a more positive intro into their pregnancy. Thank you for all playing. I appreciate the engagement. I hope you were able to learn something really quickly just from the myths versus facts. And now we're going to get into the nitty gritty, and we're going to talk about the first trimester. Awesome. Okay. So the first trimester is essentially what sets the stage for a healthy pregnancy. The first trimester will focus on establishing care. They'll want to understand available resources. First trimester, you want to prioritize nutrition. And if there's any availability, this is a good time for many pregnant women to address any early pregnancy emotions. The first step for any pregnancy, obviously, is finding a trusted healthcare provider. And there are three main trusted healthcare providers that I think every pregnant woman will need, and they have the option of seeking out. So they have the option of finding an OBGYN or midwife, and also the option of hiring a doula. So it's important for expectant mothers to know their provider options, especially since there are two main types of providers for pregnant women, OBGYNs and midwives. They both do two separate things, but they both can offer personalized and specialized care for a pregnant woman. Both of these providers are really great options for them based on the need and the care that she may want. When it comes to the major difference between these two providers, um, I typically like to explain it like this. A midwife, and most midwives, can provide care to what's considered low risk mothers, while mothers who have risk or pre-existing conditions such as diabetes, or maybe a mom is pregnant with multiples, or maybe she has other high risk issues that will develop in pregnancy such as like gestational diabetes, she will most likely see an OBGYN because she will be needing some more specialized care that most midwives are unable to provide her. But they do have both options to see. And now I know, even in some hospitals now where in rotation, there are both midwives and OBGYNs when mothers go in to give birth. So they have the option of seeing both providers at the same time. And just depending on their need and their specific care, whether or not which provider will take on them full time and which provider would kind of step to the side. So, when picking a provider, it's going to be critical for the mother to ensure that she has the medical help to help her progress through her pregnancy. So, those are the two main types of providers that a woman can pick: OBGYN and a midwife. The second type of provider that will be necessary to her pregnancy journey will be a doula. And if you don't know, many wonder, what is a doula? A doula is someone who's professionally trained in childbirth. A doula can provide emotional, physical, and educational support to a mother who is expecting, a mother who's already in labor, or a mother who has recently given birth. The purpose of a doula is to help the woman have a safe, memorable, and empowering birth experience. Um, One of the important care providers, also for many women outside of their regular medical provider, OBGYN or midwives, will be other types of healthcare professions like acupuncturists, chiropractors, being sure they have established care with a dentist, being up to date on their vision appointment and others. All of these providers can also help manage any of their like pregnancy discomforts, provide them resources to help women throughout their journey. So, say for instance, if she's having a lot of discomfort as far as body aches and pain, being able to see a chiropractor will be in her best interest because that's not really something that her OBGYN will likely perform. All of these care providers are really important when it comes to having a positive birth outcome. So this is going to be more of the foundation and the critical part of the first trimester. So now we'll talk a little bit briefly about what's to be expected during their first prenatal appointment, since they're going to be establishing care. The prenatal appointment, the first one, is very critical. It's a very crucial step in ensuring that that mother will have a healthy pregnancy. So here's some of the things that women can expect during their first appointment. Whether they see an OBGYN or a midwife, the first appointment is initially the same. Number one, there's probably going to be some type of medical history review. And this is where the provider will ask questions about their medical history, such as like maybe any previous pregnancies, if they had any chronic conditions, if they're taking any medication, and if they have any other like family health history that will be important to know during their pregnancy. One of the second things will be some type of just general physical exam, which will include their blood pressure being checked, their weight, a pelvic exam may be conducted. So there's just some type of overall small general physical they'll have done. And then, of course, there'll be a confirmation of pregnancy. So that'll be done either by a urine sample or maybe blood test that will be done. And this will help confirm their pregnancy. They may also have an ultrasound, which could be used to determine the gestational age and also confirm the baby's heartbeat. There will be some types of blood tests that may be performed to check maybe for blood type, RH factor, if she has anemia, if she has any type of infections, or if she has immunity to any certain diseases like rubella or so. They'll have a blood test to kind of help give them a baseline of where this woman's health is during her pregnancy. And then they'll kind of do like a health guidance, maybe like this will be like where the provider will offer them advice as far as their nutrition, their diet, prenatal vitamins if they haven't started taking any, The provider will probably start to give them advice on exercising and other lifestyle changes that will help support their pregnancy. And then they'll probably end the visit with just scheduling any future appointments or any follow up to prenatal visit, as well as any like instructions for additional screenings or tests. And then last but not least, they'll make time to answer any questions and concerns that that pregnant woman may be experiencing. So this is definitely the first appointment is definitely a great time for women to ask any questions or just to share any concerns about her pregnancy, maybe some symptoms that she's experiencing, maybe her emotional state, as far as if she was, if this was an unplanned pregnancy, this will be just a good time for her to talk with her provider and really just kind of share any concerns that she may have. So the first prenatal appointment is going to be the foundation of her healthy pregnancy journey. And this will kind of also help her establish trust with her healthcare team. So there are going to be four elements of a healthy first trimester, since we're breaking it down trimester by trimester, that will kind of help set the tone to, this is going to kind of help set the tone to whether or not moms are ready and equipped to kind of what I like to call survive pregnancy. The first trimester can be really brutal. So having these four key elements to help jumpstart a healthy pregnancy are going to be really beneficial to her. So some of the things that are going to help promote a healthy pregnancy will be just some safe food and drinks that she can have during the first trimester, prenatal vitamins and hydration, mental health support, and one of the most big and critical part would be her going ahead and establishing some type of support system. I'm going to focus on the next slide a little bit more on nutrition, just because that's one of the biggest elements when it comes to having a healthy first trimester. So just briefly, there are just some foods that most pregnant women will want to start to avoid during their first trimester, like raw seafood, unpasteurized products. They may want to start limiting their caffeine intake. They're going to want to start to opt in for more like nutrient dense meals to help support the growing baby and also for the baby's development. When it comes to mental health support, they want to address any mood swings, anxiety, or fear by just seeking some type of counseling. They can also join support groups, or they can start to talk to people that they just kind of trust and they can confide in. When it comes to a prenatal vitamin and hydration, hydration will definitely be the key, but they want to take a prenatal vitamin with folic acid and iron as is recommended. And then last but not least, building a strong support system, surrounding themselves with supportive family and friends and any other type of professionals will kind of help them to navigate their emotional well-being and the physical changes of their pregnancy. Like I said, these four elements are going to be the foundation to promote a healthy start for both the mom and the baby. The first trimester can be a challenge, so understanding and implementing these four elements may help them during this phase and kind of an ease of transition from the first trimester to the second trimester. So now I want to spend time and we'll just talk a little bit about first trimester do's and don'ts when it comes to food. Okay. So pregnant women obviously need to eat a variety of nutritious food from all types of food groups. And starting in the first trimester, this will help with the baby development because by the third trimester, the baby will put on a little bit, well, if not a little bit, the baby will put on most of their weight in the third trimester. Their bones will begin to harden, their lungs and brains will continue to prepare for life outside of the womb. So during the first trimester, nutrition is going to be critical. Having proper nutrition and hydration will help ensure energy, promote healthy fetal development, and it can help reduce some of the common pregnancy symptoms like fatigue and constipation that many women experience during the first trimester. So here are just a few nutritional tips when it comes to women choosing food that will provide nutrients for them and for the baby. They want to focus on stuff like lean protein, leafy greens, whole grains, nuts, seeds, fruits, all of the food that they're not craving. Okay, that's just really the truth. Everything that they're not craving is what we really want to put an emphasis on. That's going to really help them and help baby development and growth. Another big thing when it comes to first trimester safe foods and drinks is that we really want to encourage women to avoid any of these like weight loss diets. If there is for any reason why she needs to lose weight during her pregnancy, it's going to be best that she talks to her doctor or her care provider, and they're going to give her a recommendation on whether or not and how to stay within her recommended weight gain. Water is going to be critical. She's going to want to drink a lot of water. Once again, all of the stuff that she is not craving. I've had very few moms say, yeah, my pregnancy craving has been water. I hear a lot of third trimesters mothers say that as far as ice and stuff, but very few first trimesters. A lot of them crave, like I said, foods that are not usually on this list. It's a healthy balance. So being sure that they know what the healthy balance is will kind of help them with some of those symptoms that they're having and even some of those cravings. So, since the baby really has a lot of important growing to do, primarily in the third trimester, during the first trimester, we just want to encourage women to focus on making healthy choices and avoiding things that could be harmful for their development. There are a few things that can be harmful, and these are just some no-goes. These are just avoidable things that we want to encourage women to do. So, for example, raw and undercooked meat, that's one of the big ones. Deli meat, it's specific deli meat, but uh, overall, any type of deli meat, any food that or like seafood that's going to be high in like mercury, like shark. I also never heard many people say they crave shark in their first trimester, but hey, it wouldn't be on the don't list if they did it, you know? So, and then there's some other stuff like this I could see cookie dough. I could totally see that. I've been pregnant before. I could definitely see that being a first trimester craving. So yeah, here's a little list of things that they just want to avoid. A lot of us are big coffee drinkers naturally, so just limiting caffeine will be the best thing that they should do.
Shay, I have a question that just popped up in my mind when you were talking about hydration. I know one of the big things going around right now is like electrolyte packets. Do you know anything about like are there specific ones of those that are safe or things that like people should be avoiding that are could be in some of those?
Yeah, so there probably are just depending on the brand and the ingredients that are in it. I will tell you a good electrolyte drink to go to for a pregnant woman will just be pickle juice. A lot of the necessary minerals and a lot of the necessary vitamins that women are lacking in pregnancy is in pickle juice. So that's easy to get. It's not expensive to have as well. Most women aren't really they're not really kind of thrown off by pickle juice. They might even actually crave it anyways. And it's because their body is craving the minerals and the vitamins and all of the other good stuff that's in the actual stuff. But as far as like electrolytes, I would just it just would depend. It just would depend. I would just kind of just read the label, make sure that it's safe within their if they're doctors, they usually don't mind. It really unless she's a diabetic, typically unless she's a diabetic, there are really not any bad electrolytes that I can think of that would be no good. I know LMNT, somebody can fact check that for me, but I do know that is a really great brand of electrolytes that could be very useful to women. Um, it has this salty taste to it, obviously, and their senses are heightened, so they can definitely taste the salt more. But it's kind of in a flavor. I think they have a few different flavors that might just kind of help ease it. But yeah, electrolytes would be good, especially if they're having a lot of soreness. But once again, pickle juice does the same exact thing. As far as a beverage, as far as like a safe snack, electrolytes would be good. Pickle juice would be one of those safe snacks. So here's just a list of like, just some safe snacks that are going to be, easy to grab, easy to consume, easy to keep down during the first trimester. Popcorn, butternuts, crackers are good, trail mix, fruits and veggies. I know the biggest concern through first trimester is keeping this food down due to nausea and maybe throwing up. So, like I said, these easy snacks and easy drinks will kind of help women. In the meantime, hard-boiled eggs are my go-to as far as a recommendation. If you can't eat anything else, can you eat a boiled egg? It's going to be overall good for you, for the baby, for protein, for fullness, and hopefully it can stay down, And like you said, topping it off with some fruit water. They can have herbal teas are not very harmful. Just kind of watch the caffeine intake. So, like I said, first trimester will be primarily the focus will be on establishing care with their provider and then nutrition. When it comes to the second trimester, that's going to be the week 14 through week 26. And during the second trimester, we want to put an emphasis on staying active, promoting substance-free pregnancies, and starting some type of birth education. So here in this slide, I have about 5 beneficial examples of second trimester exercises that are safe and that women can do. So you got walking, you got some prenatal yoga, swimming is a really great option. Any pelvic floor exercises are going to be great, and women can still do some type of modified strength training. Uh, Oftentimes, if they were already doing it before pregnancy, they can just kind of run that by their doctor. They're safe to kind of continue that throughout the rest of their pregnancy. So doing these low pack activities like swimming and yoga or even walking, this is going to overall improve her mood, reduce any aches and pains like back pain, and it's going to help promote a healthy weight gain and keep that balance. So pregnant women should always obviously consult their provider to ensure that the activities that they're doing, if they're doing some of these that are above, like, strength training and walking and prenatal yoga, they just want to make sure that it's safe for them and for the baby. These are all exercises that are low risk. A lot of them are free activities that they can do. Everybody can go for a walk outside. Um, there are community prenatal yoga programs that are all around the state of Tennessee. But all of these are going to be beneficial to not just keeping her healthy, but keeping her mood healthy and also keeping the baby healthy. So also during the second trimester, there are going to be a few things that we can do as facilitators to kind of help women through the phase of the second trimester and also help them reduce some of second trimester risk. Number one, and the most critical, will always be to encourage them to have a substance-free pregnancy. When it comes to substance and use during pregnancy, it really does poses a serious risk to fetal development. So whether it's alcohol, tobacco, or drugs, it's going to be key for them to be abstinent. That's going to be vital. And if there's an addiction or they have an addiction that is a concern, there are really tons of resources available to help mom. And we're just going to want to help them find that support. One of the ways as facilitators that we can encourage a substance-free pregnancy will be to provide education on the dangers of alcohol, tobacco use, and drug use during pregnancy. Another second way that we can help them remain substance-free would to be just to offer some of those resources such as counseling, maybe support groups. All of these things are going to help them understand and also help them to continue to be substance-free during their pregnancy. Also, like I said, we want to start to introduce those birth classes and birth planning. We can help these families prepare for childbirth by offering classes on labor, delivery, and newborn care. We can also start to encourage the creation of a birth plan that's going to align with their birth preferences. This would be a good time to recommend a doula if they don't have one, because a doula is going to be someone who can help prepare them for labor, delivery, and postpartum. She can help them with birth planning. She can attend appointments with her mothers and go over any questions. We like to use this acronym. I like to use it. It's called BRAIN, which stands for Benefit, Risk, Intuition, alternatives, and what if I just simply say no and not yet. And a doula is going to be able to help provide them with the education and with resources that are going to help them as far as planning for birth and getting ready for any birth classes. And of course, since we're still in the second trimester, we still want to continue to talk about activities that's going to reduce any type of discomforts in pregnancy. So just continue to promote prenatal yoga, some stretching. Swimming is really good. Swimming is like my number one um, suggestion to all women. I'm like, you know what? Go for a swim. It's going to give you the strength training. It's also going to give you a lot of relief from any joint pain. It's going to take some relief off of your back, and it's going to get that baby in more of a balanced state where you're a lot more comfortable. So I really, really encourage a lot of swimming if they can. So these any of those activities that were on the page before, like yoga and walking, any of these activities will help them as far as managing pregnancy symptoms as the baby will continue to grow. And then, of course, we want to give them or help families with access to like cultural competence education material. And so, what that just kind of looks like is, for instance, partnering with other organizations that will respect diverse needs, like maybe offering classes in multiple languages, uh, maybe offering like doulas who are bilingual, or doing birth planning sessions in Spanish or other languages that are done in the community. And then, of course, to reduce some factors, we just want to just recommend like exercising, movements, all of this to help support their changing body and mobility. And that pretty much sums up what we can do and what women need during the second trimester. And as the pregnancy will continue to progress, the focus will shift from nutrition and exercising and all of these critical key components of these trimester to preparing for delivery and getting ready for postpartum. So of course, just continue to encourage like self-care, regular prenatal visits, frequent check-ins with their doula, because we're up for the journey ahead. So third trimester, and that's going to be weeks 27 through 40. This is the time to start focusing on preparing for postpartum, preparing and recognizing complications, and managing any other health conditions. So as a mom is preparing for delivery, she's going to want to start to think about postpartum checkup, maybe even establishing a feeding plan, and possibly be looking into pediatricians or potentially scheduling visits to pediatric offices. Okay. Mental preparedness is also going to be really important for the third trimester, just because it's going to be so demanding during birth as well as postpartum. So, kind of getting her to understand the demands of the fourth trimester will also already kind of help ease the transition. So, instead of her being surprised by the things that will happen postpartum, having her prepared with just kind of, like I said, taking those birth classes are going to be really cool and really helpful as she transitions to her third and fourth trimester. So on the next slide, there are some ongoing health concerns during the third trimester that we want to be on the lookout for. There are three main types or three main diagnoses that everyone should know common signs and symptoms to, so that they know when to seek out care and when to call their providers. So there's going to be the main three is going to be preterm labor, gestational diabetes, and preeclampsia. And so knowing these symptoms are going to be really critical so that they're not ignored. And if any mom has any pre-existing conditions or she develops one during her pregnancy, she's going to need to be closely monitored. That's going to be really, really, really critical. And also any medication, if she's been prescribed during her late pregnancy, she's going to want to make sure she's discussing that with her provider. So now we're going to take a look at a few of the complications and the warning signs that can arise during the third trimester that every woman should know. Should know. So here are a few of the top three common complications and warning signs and when to seek help during the third trimester. There are three of the common. You have preterm labor. This can mean signs of labor like regular contractions before 37 weeks. A lot of women are having Braxton Hicks. We want to be able to educate women on what the difference between Braxton Hicks are and what the difference of a true contraction feels like, so that she's not unsure. But usually if she's having any type of regular regular contractions. Braxton Hicks are contractions that start and then they stop. You could have one today and not have another one for 4 weeks from now, or you can have one early in the morning and you don't have one until later that night. So these are not the contractions that are considered regular. So signs of preterm labor would be regular contractions that are happening before 37 weeks. It's also associated with lower back pain and any type of pressure on the pelvis, as well as any like fluid leakage. So if she's having any of those three signs, this could potentially be preterm labor. It's not our job to diagnose them. It's our job to just let them know, like, okay, let's just go seek help. Either advising them to go straight to the hospital, which a lot of women don't know that. You can encourage women at any point during their pregnancy, if they're unsure or if they're having any signs and symptoms, they do not have to wait to go to the hospital. The hospital is open 24 hours a day. They're welcome to go in if they're concerned about a headache. They don't need permission from their doctor. They don't need to wait and schedule an appointment. They're able to go and check that out immediately. So then the second complication is warning signs we want to be aware of is gestational diabetes. Some symptoms that women may experience would be extreme and excess thirst, frequent urination. And I know y'all like, but they're pregnant. They're always peeing. This is true, but this would be more frequent, and this sense of urge of never, their thirst never being satisfied by water or whatever it is that they're drinking. If they're having any unexplained fatigue, yes, they're in their third trimester. Yes, they are tired, but they're sleeping all day and they're only getting up to go to the bathroom. And it's like a rinse and repeat cycle. This may be a good time for them to contact their provider. Most mothers by their third trimester will have tested for gestational diabetes. So if it hasn't already been confirmed and already been managed and they start to have these symptoms arise, they want to seek out help immediately. Like I said, they don't have to wait to go to their doctor. It's up to them. They can go off to the hospital immediately. I think every hospital has like an OB floor, so they're able to take in walk-ins. So then the third major complication during the third trimester would be preeclampsia, and this will include signs like persistent headache, any type of vision changes, swelling in their hands and their feet, and if their blood pressure is really kind of off the chart. So when it comes to these three major complications, as far as seeking emergency care, if they're having signs like heavy vaginal bleeding, some severe abdominal pains and cramps, maybe some sudden intense swelling in their hands and their face, or if they have not had any fetal movement for 2 hours after trying to stimulate the baby, maybe by drinking something sweet or having some type of food, they're going to want to go to seek emergency care immediately. Okay. As far as when to contact your provider or when she should call her provider, I always like to tell my moms, if it's an emergency, you contact your provider at the hospital because oftentimes they're going to do it for you anyways, or oftentimes once you're discharged, they're going to recommend you to be do a follow-up with your provider. So if they have any other questions about medication or preparation for delivery, they can always contact their doctor. They don't never need permission to call their doctor. So the third trimester is definitely going to be what's important for a doula, because when they're not able to reach their provider, they can always seek advice from their doula, and she can kind of guide them on whether or not this is like go to the hospital or, let's schedule a follow-up visit. My rule of thumb is when in doubt, get it checked out. If she has a concern about it, it's worth being checked out, even if it's just to ease her mind. So here are 5 things that women can do ahead of time that's going to help with postpartum transition. They can go ahead and schedule some postpartum checkup. They can schedule and tour pediatrician visit or pediatric offices. Every newborn baby will be given an appointment after birth within the first 3 days. They don't have to fight for that appointment. It's going to be a guarantee. Number 3, they can go ahead and identify feeding support. So whether or not they plan to breastfeed or formula feed, go ahead and get connected with like a lactation counselor, maybe even feeding specialist, maybe they delivered early, or other local support groups. And then as far as mental health preparation, just kind of acknowledging the emotional challenges of postpartum early, and just kind of identifying a trusted professional or support group that will kind of help them address any anxiety, baby blues, or even possibly postpartum depression. And then, last but not least, just scheduling ongoing medical treatment, especially if they're having chronic conditions that's related to those complications that we've seen, such as gestational diabetes. So, all of that ongoing care is going to be important for her postpartum journey ahead, and just trying to make sure she has a smoother transition from pregnancy to postpartum, and support for both her and for the baby's well-being. So that wraps up the third trimester. And now we're just going to talk briefly a little bit about the fourth trimester, which is often the most forgotten. This is what I think is the most critical about the fourth trimester, would be mental health support. Women are going to want to understand or have some type of understanding of the difference between baby blues and postpartum depression, and what are signs and when for them to seek help. So baby blues are very common during the first 2 to 3 weeks of postpartum. After, I mean, 2 to 3 weeks after delivery, some of the symptoms will be mood changes, anxiety, lack of concentration, fatigue, feeling overwhelmed. These are usually these types of symptoms can usually resolve on their own with support and rest. But when it comes to postpartum depression, this is more of a severe and long lasting condition that can develop within the first year postpartum. Baby blues is usually within the first 2 weeks. Postpartum depression can happen somewhere from the end of pregnancy after delivery up until the first year of postpartum. So some of those symptoms will include, like, anger and deep sadness. Withdrawal is a really good one to focus on and to pay attention to. If she's having trouble bonding with her baby, and in some severe cases, the thought of self-harm. Postpartum depression definitely requires professional intervention. So women definitely want to be checked after their first postpartum visit. They'll have a screening with their provider anyways. But if they somehow end up in your organization and you start to see some of these symptoms, you can always just kind of suggest to them, like, hey, how about you give your doctor a call? Or, hey, like, you can just kind of usher them gently into making sure, if they're confiding in you, to also confide into their provider if they're still having some of these major concerns. So being able to tell the two, not everybody has postpartum depression. Sometimes it is baby blues, which has a lot to do with hormones as well. So being able to recognize the difference between the two will really kind of help us as facilitators help pregnant women, excuse me, postpartum women journey past those diagnoses. So here are three main priority things that new moms can do that's going to also ease the fourth trimester. Of course, we want to encourage sleep and rest, prioritize napping when a baby sleeps. And I know for y'all who've had kids like me, like, is that possible? No, but will we still say it? Absolutely. Like, sleep when the baby is sleeping. Get some help if you can. Postpartum doulas are really great. Seeking help for any nighttime feedings, because the number one issue to leading to baby blues and postpartum depression is sleep deprivation. So being able to encourage women to get the proper rest, which is really hard with a newborn baby, and you're recovering, is going to be really key to her postpartum journey. Um, then, of course, self-care. Go ahead and remind moms to take time for themselves. I really encourage moms, as soon as they can and they're feeling better, go outside for a walk by themselves. They can take the baby, that's fine, sure, but for their own mental health, vitamin D does the body well, and sometimes just being outside will be a small self-care thing that a woman can do that's not taking away a lot from her. So just taking time for herself in small ways, like enjoying her hobby, going for a walk, having a just quiet moment to just relax. And then basic self-care routines like eating well. Nutrition is going to be critical as well postpartum. Hydration, and this is a big one, and I know y'all gonna be like, what? But yeah, showering. Okay. Postpartum moms, don't have a lot of time for anything, but we really want to encourage them to take a shower. That's going to be one of the best self-care things that a postpartum mom can do. And taking a shower by herself. If she has a toddler, having the support system there that's going to allow her at least 10 to 15 minutes to just decompress and shower. Um, so like I said, they can accept help from family and friends. Doulas are really great postpartum. Doulas can come and help with household chores, with their other children, with cooking, being sure that they build a network of emotional support. All of this is going to help reduce that stress and allow moms to focus on recovery and bonding with the baby. Those are the only two things that we really want her to do during postpartum is recover and, bond with the baby. So rest, sleep, and self-care are going to be essential for every new mother's recovery and well-being. So it's along with those three, of course, regular postpartum checkups to make sure that she's healing properly. Pelvic floor exercises. She can see a specialist and a therapist for that. And just having the resources available to women when they need it is going to be very, very, very helpful. So when it comes to ongoing support system, they may be returning to work or trying to navigate postpartum challenges. All of that can feel overwhelming. Having support groups, counseling, and helping them understand workplace accommodation. These are going to be really great resources that are going to help women and mothers thrive. Um, so lactation support is going to be really good. If they are nursing their baby, like I said, all of those transition to work accommodations are going to be really nice for her. She's already worried about leaving her baby anyway, so being able to give her some reassurance that she can still be a mother and share her career and her passion is going to be good. So I want to end before the Q&A with a few things that we as facilitators can do during the trimester and during each trimester that's going to help pregnant women through their journey. I think Brooke will also email y'all this follow-up as well if you don't get to take a picture or screenshot it if you want. But here are some ways during each trimester that you as professionals can do to support expectant moms. First trimester, prenatal classes are really great, resources to educate them, creating counseling programs are going to be really good. Um, Support basic and supplying like basic needs like prenatal vitamins, pamphlets, and meal planning will be all great ideas to help them through the first trimester. As far as the second trimester, ways that we can help would be you could host a maternity clothes drive-in for women in need. Again, support groups for mental health are always going to be great no matter the trimester. Um, you could offer like medical providers, like partner up with medical providers for like on-site screenings, transportation to support groups or to prenatal appointments, and other birth classes and labor newborn classes would be good during the second trimester. And then during the third trimester, um, providing hospital bags with like kits with essential toiletries and baby stuff would be really helpful. Hosting a breastfeeding workshop led by lactation counselors, um, facilitating access to doulas and childbirth educators, helping develop custom postpartum plans and meal plans would be a good thing that we can help expecting mothers during the third trimester. The fourth trimester, offering like postpartum care packages with like hygiene products and maybe even some lactation supplies. Um, Parenting classes or offering postpartum support groups, partnering with pediatricians for like a mother baby clinic, um, providing virtual or in-person like workshops that will kind of focus on infant care and maternal well-being. Can do postpartum exercises class, postpartum meal prepping. All of these would be great ways that we can help support expectant mothers through through their pregnancy, each trimester, as well as postpartum. So I'm going to take the time to read through any questions if I haven't had the opportunity to read through and to answer any that I can. I know we've covered a lot of ground today, from essentials, prenatal care in the first trimester to preparing for postpartum challenges in the fourth. Each of these stages of pregnancy all require tailored support. So just remember, supporting maternal health is more than just her physical care. It's mental, it's emotional, it's community support, and all of these are going to be really important for each mom. I do want to go ahead and say thank you guys for joining the webinar. I really appreciate all of the engagement. I really appreciate you guys taking the time. Thank you again to Brooke and to Chase. And so, yeah, now I'm just kind of going to end it by just taking any questions if anyone has any, or
Awesome. Yeah. Anybody have questions, feel free to come off mute and put them in the chat. It looks like we just have one come through from Tori. Um, One, do you remember how long they need to wait after labor to take a restful bath? And two, do you know postpartum doulas who take 10 care? That was one of my questions too. So interested in that.
yeah, so how long they need to wait to take a restful bath? Um, it will depend on what type of delivery did they have. Did they have a cesarean birth or did they have a vaginal delivery? Most vaginal deliveries that are low risk, they could take a bath immediately. If she had a cesarean, a C-section, it's just going to probably depend on her type of incision, on whether or not some women have their staples removed at the hospital. Other women will have their staples or their bandages removed postpartum in office. And if that's the case, a lot of recommendation is for her to delay a bath until her staples are actually removed. So that's just going to depend. Regular low risk vaginal delivery, she could take a bath within 24 hours. Cesarean, it would just really depends on her type of surgery. Next question, if I know any doulas that accept TenCare, I do. TenCare just approved doulas and they have a network. I do believe, and I could be wrong, so I have to check. I have my own referrals, but I do believe that they have their own website and you can search by maybe zip code or you can search locally doulas who are available to take TenCare. Some doulas will accept TenCare. They just kind of have to do a reimbursement. So it just really just depends on that doula. I can send you a short list of those doulas, Brooke, and she can forward those to you, Melody.
Yeah, perfect. Or even, like low cost doulas or anything like that that you have, Shay. I think this group would be happy to have those. As we have some families who probably don't have the financial needs or financial
Yeah.
means to hire, some of those doulas. So that would be great. Any resources you have for that?
Absolutely, absolutely. Let's see.
I have a quick question. Can you hear me? Because I was having trouble with my mic.
We can hear
Um,
you.
do you have tips with for parents to how they can speak with emergency room staff about a concern? Because I've had young parents who have been who've been spotting, who've had pain, a number of things that happen, of course, after the doctor's offices has closed. And when they get to the emergency room, the only thing the emergency room look at whether or not they dilated and send them back home. But there are definitely some concerns there. What tips do you have? Because I've actually had to call doctor offices myself after hours to insist on someone helping, these young parents or young moms.
Mm-hmm. Yeah, absolutely. The number one tip I would tell you is having a doula, only because the doula is going to act as like the liaison between uh emergency and non-emergency as far as trying to contact their provider's office. Like you said, they're going to go to the ER and they're going to do everything, but having a doula is going to be able to uh encourage that mom whether or not this is a true emergency or if this is something that we really need to get in touch with their provider with. That would be my first thing. Doulas are going to be their education in between. And then also I would just recommend if their provider, I would honestly say this before, I would do a lot of research on the provider that I see. I would really encourage them. at the appointment to ask their doctors, like, hey, if I so happen to have an emergency on the weekend and I need to get in touch with you, what's going to be the best route to do that? Or in touch with the office. Usually their doctors can bring them some reassurance, and usually their doctors cannot. And if that doctor is unable to do that, I would maybe consider going to see a different provider who is, because for what one doctor won't do, another one will. Um, most every OBGYN has an on-call doctor. Um, I'm not making an excuse for them. Their phones are ringing off the chart 24/7, but just kind of like you're already doing, have her continue to call and you call as well. Would kind of be the only way, unfortunately. So, but the first appointment would be where you really want to make sure your doctor's going to be available. A lot of women don't utilize their online portals, which is like little quick emails and messages that they can send to their providers, because that is also a really great option, because those messages usually have to be followed up within 24 hours by a nurse. So that's going to at least guarantee within 24 hours, they're going to get some type of response from a medical professional. And that provider or that nurse is going to either tell them, hey, we're working you in immediately because this is a critical condition, or you need to go to the hospital. If they need to go to the hospital, they're not even going to message them back. They're going to call them immediately and say, hey, Brooke, you need to head over to the hospital right now. So that would be my advice.
Thank you. I appreciate that. And this will be my last one, and I'm gonna leave you after this. Is there a time where it's too late to get a doula? You know, if they have not had a doula at the beginning, is there a time where it's too late or
Absolutely not. She could be 10 centimeters and pushing and call for a doula. There's never, it's never too late to get a doula. She could have already given birth and still ask for a doula postpartum. So, nope.
thank you. Okay, Brooke, that's it. I'm not gonna say nothing else. I'm gone.
I really appreciate the questions. I like
Yeah,
it.
no, those are great questions. Thanks,
Yeah.
Amy. Any other questions? Carla asked if we could send that to your email. Yeah, I'll get that list from Shay this afternoon before I send out our follow-up email so that I can include that for everybody. And then that may be something we even want to include on our webpage. So just be on the lookout for that. All right. Well, if anybody comes up with anything too, feel free. Again, you can always email our help desk. We have Shay on speed dial, so if we need to ask her something later on,
Yeah.
we can do that. And thanks so much, Shay, for this awesome presentation. It was really thorough. There was a lot of information. We really can tell how passionate you are about moms and helping them through this journey in a positive way. So we really appreciate you being here today and for all of the information that you gave us. And something else I just wanted to mention too is that I am going to share these slides with y'all this afternoon, and that may be even something that you can use with your families to go through the slides and teach them,
Mhm.
use that as an educational piece. Please feel free to use anything that we've created to share with them. And I will get this up on the webpage hopefully in the next couple of days so that y'all can share it with other staff members, with your clients, whoever you want to share it with. And please reach out to us if you've got a question or a need, and we'll be sure to get you some help. Y'all have a great afternoon, and we'll see you soon.